Today we have with us Dr. Mini Unnikrishnan, DHMS, renowned figure among public through writings and awareness classes in media. Former Vice President and Teaching Faculty Chairperson of Institution of Homeopathy, Kerala. One of the prominent faculty of IFPH, with 35 years of homeopathic practice and seminar experiences. And the subject is gestational investigations.
Good evening, doctors. Before the class, I'm telling you about the subject because I chose this because I'm doing infertility cases and my successful cases are investigated by myself. Because before they go to the allopathic hospitals or gynecologists, I think I have to know whether the baby or the fetus is healthy or not. And I have to know the conditions of the mother and the child as a gynecologist do. Because when we are treating infertility cases, we are also gynecologists. Just the medicine is the different. So I do this in my patients. Not all the tests I was able, because when they go to the allopathic hospital, it will go to their hands. But the first two tests I usually do. And I am describing all the tests here because I think it will take time for 2 sessions, because one session will take half.
Yes, that's good.
So I will take the half of the session today and later another session to complete the subject. So I shall share the screen now.
Yes.
The subject is gestational investigations to rule out fetal anomalies, because we have to know whether the fetus is normal or abnormal. So this is the first slide, and I'm going to the next one. Okay, let me put the slide show. Okay, can you see?
Okay.
Can you see? Okay.
Yeah, okay.
This is the first scanning. It is called NT scan or nuchal translucency scan. NT scan, nuchal translucency is done between 11 weeks, 4 days of fetal age to 13 weeks, 6 days. That is in the first trimester. That is between 11 weeks, 4 days and 13 weeks, 6 days. In that period, this scan is done. That is the first scan. We can do scan, but the confirmatory scan or a diagnostic scan is called an NT scan, and it is taken in this period. We can do a scan before this because to confirm whether fetus is there or not. But this is the NT scan is done in this period, and NT or nuchal translucency means the normal fluid space under the skin at the back of the neck of a fetus. That is, it is shown in this figure. Normal fluid space under the skin at the back of the neck of a fetus. In this picture, here is space, fetus and the skin. Is it clear? Someone please answer.
Yes, yes, clear.
Yes, okay. This space is called nuchal translucency. And this should have a correct measurement. Variation in this measurement will prove whether the child is normal or a Down's baby. Because if the measurement is higher, that is normal fluid space under the skin at the back of the neck of a fetus, normal less than 3.5 millimeter. This measurement should be less than 3.5 millimeter when the CRL is between 45 millimeters and 84 millimeters, or 1.8 inches and 3.3 inches. That is less than 3.5 millimeter when the CRL is between. CRL means crown rump length. Crown means head and rump means buttock. When the baby is lying in a folded position, the length between the head and the buttock, that is the crown rump length. Rump is buttock. Crown rump length between 45 millimeters and 84 millimeters. It is when it is 45 millimeter, that is 11 weeks 4 days and 13 weeks 6 days. Then 1.8 inches or 45 millimeters is meant in the 11th week and 4 days period. And 84 millimeters or 3.3 inches is meant for the 13 weeks 6 days period. So in between this period, this should be the NT, that nuchal translucency. That should be less than 3.5 millimeters. But less than 3.5 millimeters is not actually, while the allopaths do the test, even 2 is considered as high risk. When the data show 3.5 millimeters, even 2 is considered as high risk. So this distance is nuchal translucency is very important. So the first scanning, NT scan or nuchal translucency scan, we have to do when we give birth to a baby in the fetus, a fetus in the womb. So we have to done the first scan is the NT scan, and if the measurement is more than 3.5 millimeters, it indicates a Down syndrome. And more than 6 millimeters, that is 3.5 millimeters is over, but more, if it is more than 6 millimeters, chromosomal abnormalities and health problems to the child is detected. And it should be, it is quite confirmatory when the mother's age, pregnancy hormone levels are also against the calculations, because above 35 years, mother's age above 35 years, and pregnancy hormone levels. There are some correct measurements for said in the other slides. So this can be confirmed with the other blood test and the pregnancy hormone levels, checking pregnancy hormone levels. High risk, when it is in high risk, that is high risk means 6 millimeters or more than 3.5 millimeters mother's age and the pregnancy hormone levels. When these all agree, Down syndrome, it is high risk, and a genetic test, 2 genetic tests, that is, one is amniocentesis, that is aspirating the amniotic fluid, or CVS or chorion villus sampling, that is taking some portion from the placenta. These are the confirmatory final tests. But this amniocentesis will cause abortion of the baby. Usually it is in like that. So to the next slide. Is it clear? Can you move to the next slide?
Yes, doctor.
Okay, thank you. Okay, these are the gestational blood tests. Blood tests are 3 types, 3 blood tests are done. One is double marker test. The first one is double marker test. That is, in the double marker test, 2 hormones are checked. It is in the first trimester, 18 to 14 weeks. It is done done between 18 to 14 weeks, and it is to detect chromosome anomaly. 2 chromosomes are checked here. 2 hormones are checked here to detect chromosome anomaly. They are PAPPA and HCG, human chorionic gonadotropin. PAPPA is pregnancy associated plasma protein A, that is PAPPA, and human chorionic gonadotropin are checked in the double marker test. It is done in the first trimester, 8 to 14 weeks period. And the second one is triple screen test. Triple screen test is done in the second trimester between 15 and 20 weeks. The first one was between 8 and 14 weeks, and this one is done between 15 and 20 weeks. And in the first part of the 15 and 20 weeks, the triple screen test, In this test, three hormones are checked. One is AFP, alpha-fetoprotein. Second is human chorionic gonadotropin, and the third one is estriol. Estriol or E3, UE3. UE3 is unconjugated estriol. E3 is a component of estrogen, one among the estrogens, E3. And it is checked in the triple screen test. And the next one is quadruple test or quad screen test. It is also done in the second trimester. It is also between 15 and 20 weeks, but in the later half. It is done in the 15 and 20 weeks later half of that period. And in this quadruple test or quad screen test, 4 hormones are tested. 4 hormones meaning those tested in the triple screen test, the alpha-fetoprotein, HCG, and estriol plus inhibin A. Inhibin A is a protein. Inhibin A and inhibin B are proteins. And inhibin A is used to detect chromosomal anomalies of the fetus, and inhibin B is checked in the infertility treatment to check whether the mother is suitable for an IVF, because whether the mother is healthy for an IVF. That is, inhibin B is used to check that. And here, inhibin A is the one hormone checked in the quadruple test or quad screen test. That is checked in the second trimester between 15 and 20 weeks, the last part of quadruple test. And next one is, so we are going to the next slide. Hormones affecting the fetus. Generally, the hormones affecting the fetus are those I described here, that is PAPP or pregnancy associated plasma protein A, HCG or human chorionic gonadotropin, AFP or alpha-fetoprotein, estriol, inhibin A plus, T4 and TSH. These are the hormones affecting the fetal health, T4 and TSH. So we are going to details. Yes, hormone vs fetus. First one, PAPPA, plus pregnancy associated plasma protein A. The normal is 0.5 MOM, and it is a hormone produced by the placenta. PAPPA is or pregnancy associated plasma protein. That is, the name itself gives it is pregnancy associated, like a pregnancy associated plasma protein, and it is produced by the placenta. It is tested between 11 to 13 weeks of gestation, and when the mother, the pregnant woman older than 35 years, family history of birth defects, previous child born with birth defects, history of insulin dependent or type 1 diabetes. In these cases, PAPPA is to be done. Anyway, either the mother is an old above 35 years or below 35 years, or even she's 20 years. Now the gynecologist tests this. So we are also testing this. PAPPA, high risk, 0.5 MOM is the normal. It can cause preterm delivery, fetal growth restriction, stillbirths, increase the incidence of hypertensive disorders of pregnancy. These are the consequences of abnormal PAPPA. But this test is done to identify Down syndrome, Patau syndrome, and Edwards syndromes. These are some chromosomal anomalies. Down syndrome, that is the commonest one we see. Patau syndrome and Edwards syndrome. These are also some anomalies causing due to the abnormalities in PAPPA level, and it can also cause preterm delivery, fetal growth restriction, stillbirths, increased incidence of hypertensive disorders of pregnancy. And then to the detailed study. Yes, Down syndrome is common, and we all know that. Anyway, I am describing it. Down syndrome is also called trisomy 21. Trisomy 21 means, trisomy means one chromosome additional. That is, other than 46, a human pattern of chromosomes is 46, but here 47 chromosomes will be there, and the extra copy or that 47th one will be in the chromosome number 21. Because in the karyotype, or the I shall show this slide later, in the karyotype or in the chromosome pattern, in the 21st chromosome will show 47. That is the cause of trisomy 21 or Down syndrome. And a Down's child, we all know Down's child, and the signs and symptoms will be distinct facial appearance. The face itself denote that I am a Down's. And brachycephaly means the head will be flat. Short stature, obesity, flaccid muscles. The child will be dwarf, will be obese, and the muscles will be flaccid. Abnormally large, displace the tongue. The tongue will be displaced like in the picture. Loss at ears. Ears will be small and hearing loss will be there. Lazy eyes, vision disorder. The eyes looks lazy and there will be vision disorder. Intellectual, thinking and understanding disabilities. All the intellectual disabilities will be low. Delayed development. The general development in all his milestones will be delayed. Speech delay or loss. Some children will speak in a delayed age, but some will not. Some will be dumb. And upslanting palpebral fissures. The feature is upslanting palpebral fissures. That is, palpebral fissures means the space between the eyelids. When we open the eyes, our conjunctiva will be sick or our eye will be sick, but the space between or at that space or that opening is called palpebral fissure, and it will be upslanting because ours will be straight and the Downs will be like this. The eyes will be positioned like this. Look at this picture. The eyes will be positioned like this. These are upslanting palpebral fissures. And mouth breathing or obstructive sleep apnea. Sleep apnea will be there. Mouth breathing will be there. Immune deficiency will be susceptible to all the infections. And polycythemia. Polycythemia means RBC will be increased. RBC will be, that is the opposite state of anemia, polycythemia. And seborrheic dermatitis, skin compliance will be there. And simian crease. Simian crease is the that crease in the palm, because here is the picture. This is the normal palm. This first one is a normal palm with normal creases. But in a Down's baby, the crease will be only this crease will be there, a single crease in the palm. Can you see this? Can you see this?
Yes.
Yes, this one is the simian crease because this is the crease seen only in the simian monkeys. A type of monkey called simian monkey has a palm like this with only one crease. And so this pattern of crease is called simian crease, and it is a confirmatory one in the Down's babies. When we see a baby and if we feel it a Down's, we can just check the palm and we can identify. So this is a confirmatory palm of Down syndrome. This is the first and commonest of the trisomies. And this the PA. Downs can be caused by some other hormonal insufficiency too. But the first one is here for confirming Down syndrome. And the next one is Patawu syndrome. Patawu syndrome is trisomy 13 or trisomy D. Then the chromosome number 13 will be having 47 chromosomes, and this is Patawu syndrome, and each cell contains a full extra copy of chromosome 13. In the chromosome number 13, 47 chromosomes will be there. Here is also maternal age will have to be considered. It will be the baby have intellectual and physical abnormalities. Usually it won't come to earth. Sometimes it will. And so intellectual and physical abnormalities, heart defects, brain or spinal cord abnormalities, poorly developed eyes, low ears, extra fingers or toes. This one, extra fingers in the this picture, C, picture named C, there is extra finger and poorly developed eyes, low set ears, extra fingers or toes, cleft palate and hair lip. Cleft palate and hair. This picture shows cleft palate and hair lip. And also the babies can be monstrosities like this. This is due to the extra copy of chromosome 30. It is trisomy 30. It is also called a trisomy 30. And this is Patau syndrome, and it is very rare. I think it is very rare. Downs is the commonest. And the next one is Edwards syndrome. Edwards syndrome is trisomy 18, an extra copy in the 18th chromosome, and extra 18 chromosome, 47 chromosomes in the chromosome 18. And the signs and symptoms are small head and jaw, clenched fist with overlapping fingers. Fist will be this one, this picture. The fist will be clenched and the fingers will overlap. Intellectual disability, developmental delays, growth deficiency, feeding and breathing difficulties, kidney and heart malformations, omphalocele. Omphalocele I shall describe later because it is a hernia, and I shall describe it later. Esophageal atresia, it can also be described later. And arthrogryposis. Arthrogryposis means this type of joint flexions for extensions. Extensions instead of flexion, and flexion instead of extension. Because our joints are meant for just some movements, but the movements will be opposite. That is multiple joint contractures at birth. The joints will be like this. This picture, the first picture shows that arthrogryposis. This will be the features of the Edwards syndrome or trisomy 18. This is also very rare. And this omphalocele and this esophageal atresia I shall mention later. Next one is human chorionic gonadotropin. Then PAPPA is over, and then human chorionic gonadotropin. It is the reproductive hormone secreted by the placenta. Alpha-fetoprotein was also secreted by the placenta. Pregnancy, not alpha-fetoprotein, that PAPP or pregnancy associated plasma protein was also secreted by the placenta. HCG is also secreted by the placenta. Establish and maintain early pregnancy. It is important in the confirmation of pregnancy too. Confirm a pregnancy as early as 11 days after conception. 11 days after conception, if we check HCG, we can confirm whether it is a pregnancy or not. Less than 5 ml is milli international unit per ml is not pregnant. In non-pregnant women and men, it should be less than 5. And above 25 means pregnancy positive. And even at the 11th day, we can make it confirmatory with the use of HCG testing. And HCG between 1,200 and 6,000 in early pregnancy. Even in the early pregnancies, it can be it can become 1,200 and 600 in early pregnancies and double in 3 to 4 days. In 3 to 4 days, it will be double than this. So it is very much confirmatory. And in abortions, we can see the level is getting down. HCG, a fall over a period of 2-3 days in the first trimester, impending miscarriage. When there is a downward measurement in the HCG, it means it is the baby is getting miscarriage. Abnormal rise may be due to incorrect date. Sometimes the date may be incorrect, or twin. When 2 babies are there, the measurement will be mistaken. And in molar pregnancy too, the HCG level will be varied. And this is something I don't think it is necessary. HCG act with this is something with steroid hormones. I am skipping it because it is not related to this part. So I'm skipping that descriptions. And to the next one. This is the HCG levels. Weeks from last menstrual period. That last menstrual period of LMP. 3rd week 5 to 50. 4th week 5 to 426. fifth week 18 to 7,340, sixth week 1,080 to 56,500, 7 to 8 weeks 76,590, and likewise, and in the full term it will be 3,640 to 11,700. Sorry, 1,17,000. 1,17,000. That will be increased. Fetus with neutral NT abnormality, and that is fetus with NT more than 3.5 millimeters and high levels of beta HCG can be sometimes due to triploid fetus, because if nuchal translucency is more than 3.5 and a high level of beta HCG can be due to triploid fetus, that is 3 sets of chromosomes. Because here we say about 47 chromosomes, but if all the chromosomes have one additional, that is 46, instead of 46 there will be 63 chromosomes, and it will be a triploid fetus with 3 sets of chromosomes, and it can be it can show nuchal translucency more than 3.5 and increased levels of beta HCG. That's also rare, because a fetus of 63 chromosomes is rare, but there is also such a condition. That was I mentioning that. And this one is the karyotype. Karyotype, or the numbering of these chromosomes. Yes. This one is Patau syndrome. This is the chromosome pattern. And this one is the normal chromosome pattern or normal karyotype is this one. In normal karyotype, see, all the pictures have, all the chromosomes have two sets each. And this is the sex chromosome or XY and XX. And the other one, they are sex chromosomes. The other ones are autosomes. These autosomes give us the tradition or the legacy. That is the exchange through the autosomes, because some people resemble their father, or some sing like their mother. That is due to the autosome. This is conveyed from one generation to another through autosomes, and the sex chromosomes will decide whether the baby should be male or female. And this is the normal pattern. And instead of this, every chromosome with 2 strands, this one, see this one, Patau syndrome or trisomy 13 has 1, 2, 3, 4, 5. This one 13. When it comes to the 13th one, there is 3 sets. That is Patau syndrome or trisomy 13. And this is the triploids, that is every strand has 3. Every chromosome has 3 strands and 69 chromosomes. That is the triploids. And this one, Turner's, let it be there. This is Edwards syndrome. Edwards syndrome or trisomy 18. Trisomy 18, that is here. In the chromosome number 18, there is 3. And in Down syndrome or trisomy 21, here, the chromosome number 21, there is 3. That is trisomy 21. And these are the, this is the Down syndrome, Edwards and Patau. And this is the triploids with 69. And this is another one, that is lacking one. That is, instead of 46, there is only 45. 45-0. That is Turner syndrome. Turner syndrome is another genetic abnormality. So sometimes they will come to Earth but may not survive much. And this one is Klinefelter's. This is the here the abnormality is in the sex chromosomes. These ones were of the autosomes, abnormality of the autosomes. And when the abnormality is in the sex chromosome, transgender will be born. That is the hormonal process. that is the chromosomal abnormalities due to the hormonal process. And the next one is hormone associated alpha-fetoprotein. That is, alpha-fetoprotein was checked in the triple screen. First one was the double marker, and double marker was covering PAPPA and human chorionic gonadotropin. And this, now we come to the second step, that is the next that quad screen, triple screen alpha-fetoprotein, beta HCG and estriol. And the first one, AFP, is this alpha-fetoprotein produced by the fetus, the liver and yolk sac. Liver and yolk sac of the fetus will produce alpha-fetoprotein. This alpha-fetoprotein is the fetal form of serum albumin. When it is a fetus, it is called alpha-fetoprotein, and when it comes to earth, it will turn to serum albumin. But alpha-fetoprotein will be in a minimal level in the normal human being, and non-pregnancy level is 0.20 nanogram per ml. But when this is high, when this is this alpha-fetoprotein is high, I am diverting from the subject. This alpha-fetoprotein is confirmatory in checking the liver cancer and testicular cancer. This is the tumor marker. This alpha-fetoprotein will be elevated in liver cancer and testicular cancer. Though, so IFP is a tumor marker in this diseases also. And here, alpha-fetoprotein, it is the fetal form of serum albumin, and the gestational normals are written here, and I don't think it is to be described here. This is the mother measurement of the mother's blood. 14 weeks gestation, 2.5 to 25.6 nanogram, 16 weeks 24.8, 18 weeks 47.3, 20 weeks 64.3, and likewise. So I just mentioned it here. And AFP at 16 to 18 weeks, 24.8, that was described in the last slide, 24.8 to 47.3 nanogram per deciliter. If there is a change or there's a difference in this measurement, there will be open neural tube defects. Open neural tube defects means there's a neural tube. I shall describe what neural tube is. Neural tube is embryonic structure that develops into the baby's brain, spinal cord, enclosing tissues. Forms early in pregnancy, closes by the 28th day. That is, in the first form of brain, spinal cord, and the enclosing tissues are like a tube. That tube will develop into brain, spinal cord, and the other systems. So, at first it is called a neural tube, and the neural tube will be opened in the first stage, and it has to get closed in the subsequent days, because if it is not closing properly, the organs will be opened. The brain will be opened, or the spinal cord will be opened, and such defects will be caused. And if AFP level is not normal, this closure will not be done in the proper time, and that will get anomalies or monstrosities of the child, or something, the open neural tube defects, or ONTD. ONTD means open neural tube defects, that will be caused due to the variation in AFP levels. So the first one is anencephaly. Anencephaly means cephaly is related to the brain, so, or head, because anencephaly is I shall describe this later. Anencephaly is related to abnormal closure of the head. Spina bifida, abnormal closure of the vertebral column. Omphalocele is a big hernia. Esophageal atresia, there is some constriction in the esophagus. Duodenal atresia, some constriction in the duodenal. I shall describe it in detail. And then neural tube, that is embryonic structure that develops into the baby's brain, spinal cord, and enclosing tissues, forms early in the pregnancy, closes by the 28th day, because within the 28th day, it should be closed. And threatened abortion, multiple gestation, fetal distress can also be caused by AFP if the child is getting mature. It could be aborted for the sometimes in case of multiple gestation, AFP will be increased, because I mentioned it in the beta HCG also, because the level that one baby is secreting and the when it is two babies, the level will be doubled. So it will be natural if the baby is if there are two babies. And fetal distress, in case of fetal distress also, if the baby is dead, AFP level will be different. And confirmation by comparing the usual and unusual ranges. And that is unusual and unusual ranges is like a survey, and that is typical normal range is 0.5 to 2 or 2.5 MOM, and variation in that will be, that is a comparison. I am skipping that also, and I am going to the next session. That is that anencephaly. I am describing the anencephaly. This is anencephaly. AFP, abnormal AFP. If the mother is having abnormal alpha-fetoprotein level, the child will be having anencephaly. It is head end of the neural tube fails to close. The first portion of the neural tube fails to close, and it will cause anencephaly. Usually between the 23rd and 26th day following conception, it should be closed. If it is not closing, this the baby will be like this. That is, there will nothing be in the brain, inside the skull, because this is the normal picture. This much of brain should be there. And in an anencephaly child, it will be like this. This portion will be blank, and so head will be only of this size, this much size, and this is anencephaly. That is a fetal monstrosity. The child will look like this, or look like this. That is anencephaly. That is if the top portion of the neural tube, if the top portion of the neural tube is not closed properly, this anencephaly will be the result. Second one is spina bifida. Spina bifida means the head will be closed properly, but incomplete closing of the vertebra and membranes around the spinal cord. The spinal cord will not be closed properly. These are the three pictures. This is the head, this one. These are the portions not properly closed. That is incomplete closing of the vertebra and membranes around the spinal cord. Occulta, spina bifida occulta is the mildest. Occulta means spina bifida occulta. This one. Occulta means outer part of some of the vertebrae is not completely closed. Just the outer portion is not completely closed. Spinal cord does not protrude. Just the outer portion is not completely closed, and so that won't cause much difficulty. The second one is meningocele. Meningocele is least common. Here the meninges herniate between the vertebrae. Here, between the vertebrae, the meninges will come out. Here there is only some gap, but here there is more space, and the meninges will come out, and it will be like this. And the third one is myelomeningocele. That is most severe. It meningitis, CS of meninges, not meningitis, the meninges, the cerebrospinal fluid and parts of the spinal cord and nerve roots will protrude through this gap. This is a type of hernia, and these are the three stages of spina bifida, and this one is the severest one. And if the baby is born with this myelomeningocele, it will show this appearance. This picture, can you see this picture?
Yes.
Yes, the physical appearance. In the back of the baby, there is a space like this. And this will be the myelomeningocele. A baby born with myelomeningocele or open vertebral column, it will show this. That is due to the insufficiency of alpha-fetoprotein in the mother's blood. That is the second one. And the next one is omphalocele. Omphalocele is another hernia. It is also a open neural tube defect, and it is anterior abdominal wall defect at the base of the umbilical cord. At the base of the umbilical cord, the abdominal wall will allow the abdominal viscera to come out with herniation of the abdominal contents covered by the parietal peritoneum around the 9th week of intrauterine development. In the 9th week of intrauterine development, all the abdominal viscera will come out through the umbilicus. And this is the scanning. This scanning shows like this, a big ball, because nothing is inside the abdomen, but everything is outside in this pouch. This is omphalocele or a big hernia. This is also, I don't think whether it can be corrected by surgery or not. I don't know. But this is a born child, and this is a fetus. And this is also a scanning picture of an imaging of the fetus. And this is a born child. And these are the omphalocele. This is also a hernia. The next one, I don't think if there is time, or let me see.
I think, doctor, now we can conclude, then we can have another session. Okay.
Okay. Then we can conclude with this one, and the next one, let me see. Okay, esophageal atresia and the duodenal atresia, we can talk in the other session.
Yes.
I have an experience because, but the case was in the allopathy hospital, and the score was below 3, I think 2 point something, and they considered it as high risk. And it was one of my seniors' son's child, and we decided to give some medicine to the mother, and we were treating her with beritacartenum. We were treating that fetus with beritacartenum when the result was this NT scan showed high risk, but they did the amniocentesis. As they did amniocentesis, the baby was aborted, but the born baby was normal. The born fetus was normal while they checked, but the abortion was due to the amniocentesis. But the normal stage, I think it was from our medicine.
Yes.
It was due to this beritacarb, but the baby couldn't be born because the amniocentesis caused the abortion of the baby.
The pride and prejudice from the part of the gynecologist is the cause of misery. Well, I think there was an article in the Times of India where the doctors of the Bombay Tata Institute of Cancer Research, they admit that surgery often stimulating the chance of metastasis.
Yes.
That is they inject some medicine, lidocaine. Then another one is now they are started to inject some extract from the cannabis around the tumor, then proceed to surgery. Definitely that will prevent. These are empty speculations, but still this presented as highly scientific. We all know that during the COVID times, a couple of patients were given some medicines, wrongly some medicines were given, and fortunately the patients were cured. Then they projected this as the greatest advantage. They discovered something. Then they discovered a lot of medicines, including HCQ. We all know that what happens with these HCQ, then the plasma therapy, all things. Well, these wrong studies were projected as the achievements, the feats of the medical science. We don't have such wrong studies. That is a wrong problem we are facing.
Medicine can be given to the mother.
Yes.
And also, even if there is family history, I think even before checking, I think we can do something to prevent these mishaps.
Now, Dr. Masrina from Malaysia.
My question is regarding, a baby born with both sexual organ, male and female. Any explanation for that? Yeah, I'd like to know more if you have any experience.
Yes, that is due to that 47 that 3 chromosomes, that is instead of 2, the 3 chromosomes will be in the sex chromosome, that is the last part. Because either XX a female baby or an XY a male baby should be born. But if there is an increase in the sex chromosomes, that will be XXY, meaning XX, that is a female baby with female organs with XX pattern, and at the same time, as the baby is having XY also, that is XXY, the male organs are also will be there. And this will cause the transgender, the birth of a transgender. And this, according to the prominence of the chromosome level, it will be either look like a male or like a female. And if a baby is born with external genitalia of a male, in the inside there will be female genital organs also, and vice versa. That is due to the addition in the sex chromosomes. That is the last one.
Yeah.
I have showed that karyotype. You have seen that?
Yeah, yes, doctor.
This
Yeah.
trisomy is where of that that autosomes. And the last the 46th one was or the 23rd pair was sex chromosomes. And when the abnormalities in the sex chromosome, it will be a transgender.
Would you suggest any remedies to prevent this abnormality?
Something miasmatic should be given.
Okay, let's wait for Dr. Hariharan to share.
Okay, and
All right, thank you.
also if it is autosomal, that is, I said that I gave Beretta-Carb because that to prevent that Down syndrome, I was giving Beretta-Carb, and the baby born was the aborted baby. The fetus inside was a good one.
Yeah.
Although in the test they saw it in the nuchal translucency, it was a Downs. When it was aborted, that aborted fetus was a normal one.
Yeah.
We were giving Beretta-Carb.
Beretta-Carb.
So,
all right.
Yes, because a Downs is mentally retarded and a retarded birth. So that was the cause of my choice of Beretta-Carb. And we can do like that if the baby was surviving, we should know whether it was a good baby or not, but it was aborted due to that amniocentesis. But we can. I think we can.
Yes. Okay. Thank you.
We can give medicine to mother for the fetus because there was a case of hydronephrosis of the fetus, which was cured with epismal tenom by me.
Thank you, doctor. Thank you very much.
Okay.
Okay, doctor.